ranks as one of the top killers of women, and it strikes Latina women more often than any other group of women in the United States.
We're talking about cervical cancer, and it's leaving its mark on Hispanic women here in Kern County, a mark many are working to erase. Here's Sandra Gonzalez with the 17 News Special Report.
I don't want to die, so...
That stark reality slammed into Leticia Avalar's consciousness when she was diagnosed with cervical cancer at age 31.
I just felt awful because I didn't even want to go to work or nothing. Because I was thinking about my kids. But then they said, oh, it's going to be okay.
Leticia's cancer was detected early thanks to regular pap smears. The working mother did not undergo radiation, but she had a hysterectomy. If detected early, cervical cancer is very treatable. That's why pap smears are vital, yet many Latinas are not having them done regularly. A disturbing trend that distresses local physician Dr. Ravi Patel. He says the number of Latinas diagnosed with cervical cancer is rising at an alarming rate in Kern County.
They believe that if you have a pap smear done, there's a misconception that indicates that you are very sexually active, so they don't want their partners to know that.
Health professionals at the East Bakersfield Community Health Center see this all the time.
And one of the issues is that they are embarrassed to come in for health care, or they put their family up and, they take care of their family, so they're dealing with their family and they slack off on their health care.
Medical professionals say there are other reasons women put off their annual medical examinations. Lack of money, education, along with cultural and language barriers are keeping Hispanic women away from the doctor. A 1999 study by the American Cancer Society in California shows Hispanic women had the highest incidence rate of cervical cancer compared to women of other races, almost triple compared to white women. Researchers at Kern Medical Center found a much higher incidence rate of cervical cancer here in Kern County, 12% compared with 3% statewide and 2% nationwide.
A lot of the people who do come to the county are the migrant workers. And the other interesting thing is that 46% of the patients there who were detected to have cervical carcinoma were actually people who came from Mexico.
Local clinics are beginning to look into whether environmental factors are contributing to this growing problem.
People that live in Delano, McFarland, they probably have a higher risk because they live near fields, where pesticides and stuff like that. So that might have something to do with it too.
Doctors say sometimes cervical cancer is hereditary. That's what Leticia Avalar believes after learning 3 relatives had similar health problems many years ago. In the meantime, since Hispanics tend to be very family-oriented, medical professionals urge women not to put off those pap smears.
Do it for your family, you need to be around for your family.
Take it from a survivor. Leticia says it's a matter of life and death.
Go on the regular pap smears, because if they don't, then it's going to be too late.
Not too late for Leticia, who now holds on to life dearly. Sandra Gonzalez, 17 News.
If you would like more information regarding cervical cancer prevention or want to know how to obtain a free pap smear, you can contact Clinica Sierra Vista's Cancer Detection Program, Every Woman Counts. In Bakersfield, that number is 322-3905, extension 130, and in Lamont, the number is 845-3734, extension 105.